I'm Steve Hurd. I'm Executive Director of Good Samaritan Clinic.
I'm Kim James. I'm the Finance Manager with Good Samaritan Clinic.
Good Samaritan Clinic started in Morganton in 1996, and since then our clinic has had the mission to serve people with low incomes who are uninsured, give them primary medical care and pharmaceutical care. And we've done that for the last 20 years.
One of the facets that I do as far as administration is ensuring that we have donations and grants. And one of the big things that Steve and I both do is a lot of community outreach and engagement just to bring awareness to the mission that we have and the clients that we serve. Everybody knows someone, whether it's their neighbor, family member, anybody who could use the assistance of what the clinic provides.
We serve approximately 1,500 unique individuals every year. Our population consists of adults 18 to 65. So we don't serve people who have Medicaid or Medicare or any kind of insurance. These are people who literally fall in the cracks of our healthcare system.
We pay for it through competitive grants, through state grants, which are some are competitive, some are not, and some creative use of donations. We do have a lot of community support, which is fantastic. One of our newest initiatives is to reach out federally and look at some grant opportunities on a federal level. And we've been fortunate in achieving a lot of those goals and using our talents inside the clinic as far as staffing to really do that community outreach and engagement. The more people know, the more willing they are to support.
Every community in the United States has to make a decision about people who are in the gap in our community, and some communities organize themselves and want to help their neighbors who are caught in this gap, and thus we, through community support, the community actually wills this type of care into existence through its support through both volunteers who work at the clinic, paid providers who work at the clinic, paid staff, but it's primarily through volunteers and a community enthusiasm to do this, knowing that any one of us could become vulnerable and be caught in this gap at any time in our lives. So I just wanted to emphasize how important it is for the community to support us, knowing that the community wills this to happen for those who are less fortunate.
And it's interesting because you'll see the same names come again and again as donors, and then those people reach out to others and explain either, I know somebody who went to the clinic, or I really support this mission, or I know a doctor who volunteers, or my best friend has worked with the clinic before. It's amazing the wonderful webbing that we have and networking that we have in this community. And the community truly does care, from the hospital to other local clinics to just your average person. We have support from local business, we have support from local banking, and I don't just mean monetary support. I mean in-kind donations, volunteering, showing up for events, just saying on the street, hey, you guys are doing a great job and you're really helping people. Patients coming in and saying thank you. That's huge community support. So support for us doesn't just mean monetary. It means everybody getting together and saying, yes, we can, and how can we? Not are we, but yes, we can, and how are we going to do it?
One thing that strikes me is that a number of our volunteers are people who have been patients at the clinic. They receive such good service here that they wanted to give back. And so there's a number of patients who say, I would like to return the services that I received to another person who was in the place that I was in. I think the quality of care here is as good as what we'd find in any other sector in our community. All of our services are provided by licensed professional staff. We have, if you walk through the clinic, you'd see a clinic that very much was typical of other clinics in our community. What's exceptional about this, though, is that when people need specialist care or access to radiology or access to laboratory exams or even access to inpatient care, we have community partners that will help us do that so that people aren't left in the lurch.
One of the main ways that the foundation supports what we do is through word of mouth, public relations, advertising. They're one of our big community partners and community advocates, which is phenomenal. From my perspective, we deal a lot with obviously grants and finances. The foundation is sort of our funnel for funding for things that need to go through hospitals. Certain grantors prefer to grant to a hospital, and then the hospital can be the fiscal agent. And so the foundation has really done that with the Duke Endowment. But they've been a great partner in saying, what do you guys need? And we'll help you get there. And so that's been a really, really helpful part. They're not prescriptive in saying this is what you must do, but it's what do you guys need and how can we help you get there? We have access to these resources. Let's work together to get them. And now let's get it to the patients. It's all about the patients. It's not all about, we're all middlemen in this. You know, the idea is we have this group of people who need assistance. And our job as you know, community members, as people in general, but specifically in Burke County, our job is how can we make that happen? We're in a very unique position where we have some control over how to make that happen. And in association with the foundation, makes it a lot easier when you have partners who say, we're in the fight with you.
I would like to say that Blue Ridge is an integral part of helping us deliver our mission. As Kim mentioned, the Duke Endowment Fund sends a significant amount of money to the community, specifically identified to serve the low-income folks who have no insurance. And Blue Ridge Foundation applies on the benefit of these people. We happen to be the fiduciaries, those that actually Blue Ridge entrusts us with the funding that they obtain through Duke, and entrusts us to deliver quality care to those individuals that are identified. So we have an excellent rapport with Blue Ridge in terms of making sure we have the necessary conversations to ensure that we're doing a good job.
I would say the first thing that people can do if they want to contribute to the clinic is come check out the clinic. Come take a tour, come meet our patients, meet our staff, and really see if you want to be invested in this. I can pretty much guarantee you'll discover that you want to be invested. Many of the staff that work here started as volunteers, and donating again and supporting does not just mean financial. It might mean coming to volunteer. If financial is the way you want to give back, that's phenomenal. And all you have to do is contact the clinic. We have many anonymous donors. We have many donors who give but don't want to be recognized. And we're very big on recognition. So we always make sure, are you sure you don't want to be recognized? But I would definitely assure people that we want you to come and check us out and see what we're doing. You know, it's not just take it at face value. Walk in and you know, become a part of the clinic and see what you think. And I think you'll really be touched and moved by the wonderful good things that are happening here.
The ultimate reward I have is the opportunity and the privilege to listen to people who have had immense struggles in their life, hear their story, hear how they've been able to manage throughout extraordinarily challenging circumstances that I myself might not be able to endure. That gives me inspiration to think that we have so much resilience in our community. The other part that I would like to share is that with the media constantly concentrating on what is wrong with America and what's the challenges and the danger, coming to the clinic you get an idea of how people are helping people, neighbor helping neighbor, all the good things that are happening every day multiplied by thousands of good things compared to those anomalies that exist but yet are highly publicized. So I think if people come here, they'll get much more of that spirit of, yes, we do help each other in this country. Having good health leads to confidence and self-sufficiency. If any one of us are struggling with pain in our bodies, it's really hard to function either applying for a job, staying employed, doing what we need to do to take care of one another. And if we're there to help people remove their pain, help them feel better, we're contributing to their overall well-being and to the well-being of our community. We rely upon one another for help, and helping each other out is what makes our community healthier.
Mm-hmm.